Hello, I'm Richard Elliott, the Executive Director of the Canadian HIV/AIDS Legal Network. This has been an important year for the Legal Network, and in recent weeks you may have heard from us with updates on critical issues that affect the lives of people living with or vulnerable to HIV and AIDS. After extensive preparation, we launched a lawsuit against the Government of Canada over its failure to protect the health of people in prisons by refusing to implement clean needle and syringe programs to prevent the spread of HIV. Most recently, we welcomed the introduction of Bill C-398, which will allow Canada to deliver on its pledge to get affordable medicines to developing countries. This bill, on which we've been working tirelessly for many years, has the potential to save millions of lives. However, we also recently received a devastating ruling from the Supreme Court that says that even the responsible use of a condom does not protect a person living with HIV from criminal prosecution for not disclosing his or her status. 14 years after a landmark case in which we intervened, and despite significant advances in science, the Supreme Court has opened the doors to convictions for non-disclosure, even where the risk of HIV transmission is negligible. There was a lot of confusion immediately after this ruling on whether this was a victory for human rights. Let me state clearly, it is not. We will continue to make sure that everyone understands the significance of this ruling. This is the kind of work we've been doing for the past 20 years, defending and promoting the human rights of people living with HIV, and of people in communities particularly hard hit by the pandemic, here in Canada and around the world. We do this challenging work because the history of HIV has shown us time and again that without protecting and promoting human rights, we will never overcome this pandemic. When stigma and prejudice keep people from seeking HIV testing, treatment, or support services, this is a human rights issue. When women are sexually or physically assaulted or impoverished because the law denies them equitable access to family resources, they are more vulnerable to infection and less able to get adequate care if they have HIV. When sex work is criminalized, it becomes more difficult for sex workers to control their working conditions, and so their health and safety is undermined. When people who use drugs are harassed by police instead of getting effective harm reduction services, it fuels the epidemic. When gay and transgender people experience violence or their very identities are criminalized, how can we expect that HIV prevention and care efforts will succeed? So, using the law to defend and promote human rights is essential to effective HIV prevention and care. But just as importantly, we defend and promote human rights because it's the right thing to do. But I must tell you that our ability to do this important work is at risk. As you may have heard, the Legal Network's funding under Canada's federal AIDS strategy was recently cut by 2/3. Not because the activities that we proposed were considered advocacy in and of themselves, but just based on the mere possibility that our work might produce something that could be used for advocacy in the future. Think about that for a second. Much of our work is being deemed unfundable. Tools for people and organizations to defend their human rights are now unfundable. This is a very significant blow to the Legal Network, one of the world's leading organizations addressing HIV and human rights issues. Indeed, it is the biggest funding challenge we have faced in our 20-year history. But our work is more important than ever. We have the tools and the knowledge to end AIDS. What we need is the political will and the resources to do it. We're committed to overcoming this funding challenge, but in order to do that, we need your help. If you haven't yet become a member of the Legal Network, please do it now. If you value our work, please make a donation, or better yet, become a monthly donor. We need to build an immediate and lasting coalition of individuals and foundations in order to offset this blow to our funding. This starts with you. Join us and help the Legal Network defend the rights and dignity of people living with or affected by HIV and AIDS. Thank you.